Animals may carry bacteria, viruses and parasites. Some of these microorganisms can be transferred from animals to people and may cause diseases. Such diseases are called zoonoses.
Zoonosis is another name for zoonotic disease. This type of disease passes from an animal or insect to a human. Some don't make the animal sick but will sicken a human. Zoonotic diseases range from minor short-term illness to a major life-changing illness. Certain ones can even cause death. But why human doctors do not know so much about zoonotic diseases? Zoonoses are the diseases that are naturally transmitted between vertebrate animal and man. There are over 300 zoonotic diseases that are reported from developed as well as developing countries of the world. Unfortunately, zoonotic diseases are not included in the curriculum of human medicine in many countries of the world, and therefore, human physicians are not much aware about the symptoms, diagnosis, treatment, and control of zoonoses. Many of the emerging infectious diseases, including those caused by bioterrorist agents, are zoonoses. Since zoonoses can infect both animals and humans, the medical and veterinary communities should work closely together in clinical public health and research settings. In the clinical setting, input from both professions would improve assessments of the risk-benefit ratios of pet ownership, particularly for pet owners who are immunocompromised. In public health, human and animal disease surveillance systems are important in tracking and controlling zoonoses such as avian influenza virus, West Nile virus, and foodborne pathogens. Comparative medicine is the study of disease processes across species, including humans. Physician and veterinarian comparative medicine research teams should be promoted and encouraged to study zoonotic agent-host interactions. These efforts would increase our understanding of how zoonoses expand their host range and would ultimately improve prevention and control strategies. Now, types of zoonoses. The types of zoonoses include those caused by a virus, bacteria, fungus, parasites. Zoonotic diseases spread by mosquitoes and ticks are some of the most serious of these diseases. How they are transmitted: through the air, by eating contaminated meat or produce. Close contact with an infected animal, by touching an area or surface that an infected animal touched. Through insect bites like mosquitoes or ticks. Many transmissions occur when people hike, bike, boat, or enjoy other activities in the great outdoors. Petting zoos are also common places for a zoonotic disease to be transmitted. Those who live and work on farms are in close contact with many types of livestock. Livestock is a common carrier of many zoonoses. Examples of zoonotic diseases: animal flu, anthrax, bird flu, bovine tuberculosis, brucellosis, campylobacter infection, cat scratch fever, cryptosporidiosis, cysticercosis, dengue fever, Ebola, encephalitis from ticks, enzootic abortion, erysipeloid fish tank, granulomagiardiasis, glandus, hemorrhagic colitis, hepatitis A, hydrated disease, leptospirosis, Listeria infection, looping, Lyme disease, lymphocytic choriomeningitis, malaria of infection, parrot fever, pasteurellosis, plague, Q fever, rabies, rat bite fever, ringworm, Rocky Mountain spotted fever, Salmonella and E. coli infections, streptococcal sepsis, swine flu, toxocariasis, toxoplasmosis, trichinellosis, tularemia, West Nile virus, zoonotic diphtheria. There are also ways to help prevent getting a zoonotic disease. These include the following: wash your hands diligently. Use insect repellent or other methods to keep mosquitoes, fleas, and ticks away. Practice safe food handling. Avoid being bitten or scratched by an animal. Have your pets vaccinated and take them for regular annual visits to the veterinarian. Talk to your veterinarian about appropriate flea and tick preventatives for your pets. Check for ticks when you've been outside. Don't eat, drink, or touch your eyes or mouth while you're handling or in close contact with animals. Use gloves if you need to handle an animal that is or appears to be sick. Keep any areas where animals are kept clean and sanitary. Be aware of areas where animals or insects might be when you're out in nature, especially when you participate in activities like hunting and camping.